Good afternoon. My name is Johnny Ball. I'm the Vice President of Marketing and Public Affairs here at South Georgia Medical Center. First, I want to thank everybody for taking their time out to come and join us at the press conference. As you are aware, we did a press release on late yesterday afternoon on the current state of patient care as it relates to COVID-19. We are going to answer any questions that you have and hopefully explain as much as we can dealing with HIPAA. Obviously, we have to make sure we're still making sure we're understanding and taking care of HIPAA and privacy. But we're going to have Dr. Brian Dawson, who is our Chief Medical Officer, come in and explain everything that's taken place over the last couple of days and let you know what we have done as far as preparation and what we are going to be doing in the future. Dr. Dawson.
Good afternoon. My name is Brian Dawson. I'm the Chief Medical Officer at South Georgia Medical Center. And if you'd allow me, I'd like to go ahead and introduce some of the other members of our medical staff who are here that are present today. We have Dr. David Retterbush. He is our Chair of Surgery. We have Dr. Sid Staten. He's our Chief of Staff. We have Dr. Pankaj Agrawal. He is our Chief of Hospital Medicine. We have Dr. Greg Beal. He is our Chief of Medicine and a pulmonologist on staff. Behind me here we have Dr. Clark Connell. He's the Chief of Emergency Medicine. We have Dr. Roberto Garcia. He is the Vice Chief of Medicine. And we have Dr. Steven Ziegler. He is our upcoming Chief of Staff, or our Chief of Staff-elect, and our prior Chief of Surgery. And we have Dr. Lex Culbreth. He is our Post-Chief of Staff of the hospital. These members of the medical team have been involved as part of the clinical team that's been helping us with this COVID-19 issue as it pertains to our community, in particular South Georgia Medical Center, in addition to many other personnel that work for our hospital in both nursing, allied health, and all the other ancillary services that have helped to support us in this process. Today I want to share with you about COVID-19 and how it has affected our hospital and what we're doing to address this issue as we move forward. As you all are probably well aware, COVID-19 practically did not exist on this planet until December of 2019. As an organization, we were aware of this as soon as it began to come about as we reviewed through the literature. In January of 2019, as an organization, we began to build upon our pre-existing protocols that we had to deal with airborne illnesses and potentially catastrophic illnesses and diseases that can spread throughout a community. Since this was unique, we realized that we would need to take additional efforts to evolve our current system to ensure that we would be able to address this appropriately with the appropriate personnel, equipment, and processes to make sure that we had everything in place as we move forward. We continued this process of building as we went forward to the point that even on February the 28th, we had a drill where we had a patient came in, or a fake patient come in as a mystery shopper to go through our facility to see if we could trigger off and make sure that our personnel were able to adequately identify this individual as being as a risk for COVID-19 and respond appropriately, and they did very well. We did find out here recently that we have had our first COVID-19 case in Lowndes County. I'm sure most of you are aware of this because it has been on most of the media outlets over the course of the past 24 hours. This patient is someone who was in our hospital, although they are not here now. This patient is not in our hospital now, but they were in our hospital from March the 5th until March the 7th. While the patient was here in the hospital during those days, the patient was admitted and we were undergoing evaluation to determine the etiology of this patient's symptoms. During the course of this evaluation, this patient began to destabilize and became unstable, requiring one of our physicians to step in to help secure her airway by intubating her, placing her on a ventilator, and subsequently having to send her down to another hospital in Florida where they could provide advanced services. Once the patient went to this outside hospital, that hospital did a continued evaluation that we had begun here at South Georgia Medical Center. And after being sent there on March the 7th, we were notified on March the 11th that the patient was positive for COVID-19. Once this was brought to our attention, which was yesterday, we immediately made efforts to put forth a press release and identify any staff that had been exposed to that patient while they were here. In the process of tracing through the individual staff members that could have been exposed to this patient, we were able to track down individual people and risk stratify them as to who would be the high, medium, or low risk for developing COVID-19. What we do know is that we're very thankful for the fact that our staff was very strict in using their PPE, which is their personal protective equipment, as appropriate in the hospital. We know that we can track this documented clearly during at least 49 hours of the patient's 54-hour stay here while they were here in the hospital with the staff. As such, as we move throughout the patient's hospitalization, we see that there are certain people in accordance with CDC guidelines that we can risk stratify as being high, medium, or low risk for exposure to COVID-19. And in accordance with those guidelines from the CDC and in cooperation with the Department of Public Health, including Dr. Bill Groh, who is one of our local physicians here for years, but has worked for the Department of Health now for the past decade or so, we're able to put together a collaborative effort to help trace through this and come up with a plan to address these issues. So in these different stratifications of patients or individuals that work here in our hospital that could have potentially been exposed, there are some people that are at high risk that we've recommended that they stay at home for up to 14 days from their last date of exposure. During that time, they're going to undergo continued evaluation and monitoring. There are other individuals that are at very medium or low risk that they would take the precautions that any of us would take when we come to work. We certainly recommend that anyone, regardless of this virus or any other illness, that at any time, if a staff member has fever, cough, or any indications of an upper respiratory illness such as influenza, that they stay home during that time. Even when staff members have any kind of an illness, we always ask them to be evaluated before they come in and potentially expose other patients. As we move forward in our preparation, we have already done many things as we've started to implement some changes. I think many of you may have seen that we've changed our visitation policy. We've made sure that our 21 isolation rooms that we have in our facility are available and ready to use. We have an additional unit that we're able to potentially open upstairs if we need to place these patients. We have additional room for spillover in the emergency department should we have to need a place that has additional negative pressure rooms for these patients to be treated. Furthermore, we've gone through additional training with our staff. We've modified our process to make them even more strict, and we've even made sure that we have reached out to the community, and that's part of our effort right now. I want to say that we're very thankful for all the help that we've received, not only from the community, but our staff. They've actually been very good in making sure that they're responding promptly. To be able to get this many doctors all in one place for 5 consecutive minutes is nothing short of a miracle on most days. But they've been all very supportive anytime we've called for anything. Even individuals that have had busy office practices have stepped in as a means of service to our community to make sure that they're doing the right thing for these patients. All the rest of our staff, from nursing, ancillary services, the administrative services, they have all been very helpful and supportive in making sure that we do the right things. I also want to say that we've been very thankful to have a good working relationship with specific members of the Department of Public Health and from the CDC. One thing I would like to say before I close out my part is we always like to talk about what the public can do to help us. And some of those things that we want you to remember, all the basic things that we need to recall whenever we're thinking about dealing with any viral illnesses. Wash your hands for at least 20 seconds. If you're going to use your alcohol-based rubs, make sure they're at least 60% alcohol or greater. Don't touch your mucous membranes of your eyes, nose, or mouth unless you've recently washed your hands. If you have any symptoms such as cough, fever, any shortness of breath, sore throat, please contact your healthcare provider first and get more direction from them on what you should do as you move forward. And of course, if you've got anybody that's not ill, I want to emphasize this. Rather than bringing asymptomatic patients to the emergency department for evaluation, I would recommend you would call your healthcare provider before you make that decision. Okay? Johnny? Does anybody have any additional questions about anything? Yes, sir.
Can you all verify from the Department of Public Health, they've said that there's only one patient that has gotten the presumptive positive diagnosis. Can y'all confirm that that is the same patient that Moody Air Force Base said is a dining employee?
Although for patient privacy purposes, I can't confirm that it was the patient from Moody. What I can tell you is that in Lowndes County, that I am only aware of there being one patient who has been diagnosed as having a presumptive positive COVID-19 test. Yes, sir.
In terms of this as well, can we know the gender and age of this patient?
I'm sorry, I'm not able to disclose that for the reasons of the individual's privacy.
And have you guys been able to get in contact with all of the people that they were potentially in contact with before being tested positive?
So we've been able to push through, but we're always looking for more. That's one of our efforts is to never try to oversimplify this process. And so every time that we talk to another group, we make sure we keep trying to pull more people to make sure that we can identify as many potential exposures as possible. What I can tell you is that we were able to very rapidly identify the people that were at that highest risk exposure, and there's only a small number of those, and be able to treat those appropriately. But thank you for that question. Okay.
And are you available to tell us exactly how many or ballpark of the high, medium, low risk people?
It's hard for me to be able to tell you exactly what the number is of high, medium, and low risk, and I'll tell you that's because that is a somewhat fluid definition, as that's why we continue to follow with them, because if they have any changes in their clinical status, then that would change them along that scale. Also, we come in and we try to make sure that we break down the specific number in these individual categories, but to our current knowledge, out of all these, we only know of 5 people that are in that high risk category. And they are being very closely monitored at this time. Does that answer your question adequately?
Yes.
Okay.
Did this patient come through the ER, or how did they enter the facility? And then can you kind of explain that process of when they came in to where y'all put them?
So although I will tell you that I can't tell you the very specifics about this patient's course through the hospital, what generally would happen with such a patient would be that they would present to the emergency department, where they would undergo an immediate evaluation and stabilization if necessary for any underlying emergency conditions, and then their disposition from the emergency department to one of the inpatient units, whether it be in the medical surgical tower or on the tower that has the ICU beds. But I'm afraid I can't be very specific for the individual's privacy.
You did mention there are 21 isolation rooms. Was this patient in one of those isolation rooms?
I don't know the answer to that question right now, because I know the patient was in a room where they were intubated. I just don't know the specific answer to that question right now.
And can you give the current condition right now of that patient?
I know that the patient is still critically ill and being treated at this outside hospital. And that was as of about 1 p.m. today.
And are you aware if that patient was someone who traveled overseas?
We have no indication that patient had traveled overseas that we're aware of.
Can you divulge the hospital in Florida that they're currently at?
I'm sorry, but I can't. Any other questions?
In terms of other patients around, do we know if there's any other patient contact with this one in terms of whether it's just the hall, just meeting, whether they're in a waiting room?
Not that we're aware of, no. This patient was taken directly back to a treatment area as soon as they presented to the hospital.
And I'm sorry I mentioned this earlier, but are people that possibly came in contact with this patient being identified, or people are trying to look for those people?
Yes, yes.
In terms of staff that interacted with this individual and their families, have you been in contact with whether they want to quarantine, whether they want to take measures of their own in terms of family?
You're talking about the individual family members?
Yes.
What we're recommending is that they follow the specific guidelines of the CDC and the Department of Public Health in that regard, which are fairly specific, and it's outlined on their website.
And you mentioned that you guys had prepared beforehand, but after having this case, do you guys know of any changes that you are looking at making, thinking of making on the medical end of things?
So on the medical end, from the physician standpoint, our treatment regimen in this case would still be one of supportive care, stabilization. I mean, whenever we take care of a sick person, there's 5 basic steps that we go through, which is stabilization, diagnosis, treatment, disposition, and reevaluation. So as far as that process goes from a medical standpoint, that holds stable. But from a public health and patient safety standpoint, we do want to make sure that we are providing the absolute safest environment for all of our, not just our patients, but also our staff, visitors, volunteers, and all members of the community. So we have made some alterations in our visitation policy to make sure that we can better protect those members of not just the community, but the people that are in this hospital. But we are prepared, if need to, that we can make those a bit stricter if we have to under the circumstances. But thank you. That's a good question.
And can you go into those changes just a little bit more? You mentioned the visitation policy.
Without me misspeaking, Johnny, do you think you can tell us specifics of it? I know that we have a limitation on patients as far as like small children or young adults if they're age 18 or less. We recommend that people have 1 to 3 visitors or less, and we could possibly restrict that further. Certainly anybody that presents with any kind of cold, cough, flu, fever, any kind of symptoms like that, we strongly recommend that they not be, they shouldn't be in the hospital visiting people, just like a staff member shouldn't be here. Regardless of coronavirus or anything else, if you're sick, you shouldn't be visiting sick people in the hospital. Okay. All right, Johnny?
Well, Dr. Dawson, I definitely appreciate you taking the moment to brief everybody on what was going on. But once again, we want to make sure that it's extremely clear that we have not treated any known COVID patients here at our facility. Obviously, we had a person that came through our facility that is now down in the hospital in Florida, but we do not have anybody in any of our campuses as of right now. So we have our 3 facilities and our Smith Northview Hospital, so there's nobody in any of our facilities right now with COVID-19. Obviously, see, it takes a lot of individuals to take care of the patients in our community, and so we definitely appreciate all of our doctors taking time out of their very busy schedules to come out and show their support on what we do here every single day, and we will continue to make sure that we try to make South Georgia Medical Center the safest hospital possible. If there's any additional questions that you may have after we end this press conference, please let us know. And obviously, things are changing. This is a very fluid situation, and we will try to update you as much as we can and as quickly as we can. So we thank you for taking the time out to come out today. Thank you.